Welcome to episode 4 of the Lymphatic Massage Therapist Book Club, and we're looking at chapter 4 of High Definition of Body Sculpting. This is a great chapter. I love this chapter a lot for us to know and see in this chapter as lymphatic massage therapists, because it is preoperative assessment and preparation for high definition body sculpting. So they start out right out of the gate on page 49 and say that one of the keys to success is for the surgeon to determine expectations and then set realistic ones based on the patient's physical condition. Importantly, this is, I wrote this down. I really love this. Since body dysmorphic disorder occurs in 7 to 15% of patients seeking cosmetic surgery, some patients will not be satisfied regardless of how successful the surgeon believes the procedure to be. So I've definitely seen this, not specifically in any of my clients in my studio, but I have seen it on the internet, where you'll see someone and they will post their picture and you'll think, you know, that's a pretty good result. Like, what did the befores look like? Like, you look great. And they're just really frustrated. They don't think that they got the result that they want. And then alternatively, I have also seen on Facebook groups a lady just really frustrated that she spoke with the surgeon and the surgeon declined to have her do the surgery with them. And she was very frustrated. She didn't know why the surgeon had said no. And that was the first thought in my mind was, you know, I don't know anything about that person's history, but the first thing that comes up is it's a very good decision when a plastic surgeon says no to you, because either the surgeon feels like he can't get you the result that you want, or more importantly, this body dysmorphic disorder will come up, and if they think that you will not be satisfied with the surgery that they can give you, it's a very professional decision to decline to do surgery. And as a lymphatic massage therapist, if I see someone and I don't think that they need 10 sessions and they're really pressing me, I will say, you know, like, I can't do it. I'm not going to do lymphatic massage on someone 5 days a week because they think they need lymphatic massage. If indeed that I look at them and I evaluate them and I don't think it will be benefit for them. So that's my personal ethics that come up, and it has a lot to do with this body dysmorphic disorder. And then another really interesting thing that they said, which I'd never really heard kind of put out, and I'm really pleased in the quality of this textbook. A patient who does not trust the surgeon fully may be dissatisfied with the outcome regardless of the surgical result. So if the client doesn't trust the surgeon, that can actually affect their thought process and whether they like how their surgery turned out. So more evidence that, you know, us as lymphatic massage therapists can say, hey, what does this mean for us? In my opinion, it means get out there on social media, do the full intake, make sure you have that trust and rapport with the clients before they start taking your massages regularly, and build that trust and keep that trust. Because if you don't have a trust between the therapist and the client, I would say, you know, without any proof, but I would say that this may definitely be true for the massage therapist as well. Whether we're getting results for the client or not, if they don't trust us, they're not going to trust their results with us as much. Okay, so now I'll go to page, let's look at page 51, just if you have this book, you can look at this list. This is a really great list. And these are the surgeons talking to other surgeons. What is their preoperative health status? What are some drugs that interact with the lidocaine? And they give a lot of lists of the drugs. And then herbs and foods with antiplatelet or anticoagulant effects. And I really, really like that list. And I really like that, we'll talk about it some more in a minute, but they talk about how before the surgery, you have to stop using these medications as supplements. So I like people to eat a normal diet full of real whole foods that you get from the produce section in the grocery store versus just taking a mouthful of supplements. So some of the supplements that they're talking about, like if you're taking a pill that's garlic, ginger, ginkgo, ginseng, licorice, onion, papain, arnica, bromelain. Interestingly, neither of them in supplement form before surgery. Capsicum, celery, clove, fish oils we hear a lot of, and then the research is really interesting whether the fish oils are true or not. But I think in a situation like this, we're probably better to have the client go back to their plastic surgeon and take the advice directly from that plastic surgeon. Okay, so then page 52, they talk about it again. I really love it. Abdominal protrusion due to intra-abdominal fat, muscle wall weakness, and rectus diastasis will not improve with lipoplasty alone. And I love how they're talking about that constantly in chapter after chapter, that you cannot use liposuction to get a completely flat stomach and then think that only surgery is going to give you a completely flat stomach for the rest of your life. The surgeons here are very clear in this book, and I really like it because I find myself talking to the clients afterwards, and frustratingly for many clients, it really feels like for me that it's the first time that it ever hit their ears that they're gonna have to do core work after their exercise. Some of them are really into that wishful thinking that if they only have 2 or 3 rounds of lipo, that they'll never have to exercise again, and they'll have the dream bodies like they think on Instagram, like they see on Instagram. And then on page 52, they talk about the test that they use. Simple test, the client lying down and then performing a movement that will show whether they have the diastasis recti. So that's really interesting if you wanted to know more about that test. That is on page 52. 55, great image of the different shapes, and they're really pro shape A here. But here are the different shapes. And again, more information in the chapter on how they do the liposuction in order to achieve that type of shape with the buttocks. Page 61 is preoperative instructions. So they have very detailed preoperative instructions. What do I like? They have advice on supplements. Don't take dietary supplements for 2 weeks before and after surgery. Vitamins, and then a lot, ginger, ginkgo biloba, garlic, ginseng, fish oils. They increase the risk of bleeding and bruising during and following surgery. So that's where in those final 2 weeks, the natural diet of foods, real foods that you pick up from the grocery store in the produce section, really will help the client. Do not drink alcohol for 5 days prior to surgery. Do not smoke for 2 weeks before and 2 weeks after surgery. Smoking reduces blood circulation, slows down healing, and increases complication. Do not take aspirin or products containing aspirin for 2 weeks before or following surgery. Interestingly, birth control. No birth control pills, estrogen replacement therapy, 3 weeks before surgery, 2 weeks after surgery. And then what else? They just talk about the usual stuff that we've seen, that you shower with the antibacterial soap, and don't drink alcohol for 5 days prior to surgery. It may increase your risk of complications, including bruising. So that's it. And then page 63, this is, you ladies will know, this is why I love the book. Post-operative instructions on page 63. It talks about menial lymphatic drainage. It is recommended that you start a course of MLD as soon as 2 days following your procedure. This specific and gentle massage should be performed by practitioners specifically trained in the technique. Gentle massage. This will help accelerate healing, reduce hardness, improve bruising, swelling, improve results. As many as 8 to 12 treatments can be performed 2 or 3 times a week. So I have people come 2 times a week. And then they have advice from diet, refrain from drinking alcohol for 5 days, don't smoke for 2 weeks, and they talk about drains. and expectations after surgery, and that's and then just like post-operative medications and more information. So this, I really like this chapter. It has a lot of information in it, chapter 4, and it would be really good if you had not seen a typical pre-op and post-op instructions from a surgeon. This is a really good reference to have these typical pre-op and post-op instructions that the plastic surgeon might give your clients that are coming to you both before and after surgery. All right, have a good day.